shows.
Whenever the modelers come in, they give a worst case scenario and a best case scenario. Generally, the reality is somewhere in the middle. I've never seen a model of the diseases that I've dealt with which the worst case scenario actually came out. They always overshoot. Looking at what we're seeing now, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases, but I just don't think that we really need to make a projection when it's such a moving target that you can so easily be wrong.
Dr. Anthony Fauci there. President Trump had expressed a desire to have the country back up and running by Easter in 2 weeks' time. But in a briefing in the last couple of hours, the president said the modelling they have at the moment shows the peak in the death rate will hit in 2 weeks. He says as a result, the restrictions will stay in place until the end of April.
I'll say it again. The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks and during this period, it's very important that everyone strongly follow the guidelines, have to follow the guidelines that our great Vice President holds up a lot. He's holding that up a lot. He believes in it so strongly. The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th to slow the spread.
President Donald Trump. In the UK, authorities say it could be 6 months before life returns to normal and say any restrictions would be eased gradually. Meanwhile, officials in the 2 European countries hardest hit by the pandemic, Italy and Spain, say they believe their countries are near the peak of the outbreak. Italy's Deputy Health Minister says he expects to see a significant drop in cases within 10 days, with officials heartened by a drop in the daily death toll. The ABC's Samantha Hawley has more.
In Italy, the death toll is more than 10,000, and in the worst-hit region of Lombardy, another 416 people have died in the past 24 hours, taking the toll there to 6,360. The nation's Deputy Health Minister, Pierpaolo Sileri, is confident the peak has now been reached.
I believe the lockdown starts to work. I mean, we start the lockdown at the middle of March. I mean, we did start with the first lockdown between the 8th and the 9th of March. So obviously you need to wait at least 14, 17, 18 days after that.
In Spain, there's grim news too. In the past 24 hours, 883 people have died. That's the highest daily rise there yet. Across Europe, more than 20,000 people have lost their lives to COVID-19. In the UK too, the figures keep rising. 1,228 deaths, and the peak is not expected for a few weeks yet. UK Minister Robert Jenrick announced a new phase of preparation and coordination.
All parts of the country are now on an emergency footing. This is an unprecedented step in peacetime.
That includes strategic coordination centres, including police, fire and ambulance officers across the country.
We haven't done anything like this since the Second World War.
The government says Boris Johnson, who has coronavirus, remains firmly in charge from isolation. Letters are being sent to all residents, warning the worst is yet to come and current restrictions could be tightened.
Samantha Hawley reporting. The Australian government has announced a further restriction on public gatherings from 10 people to 2 in a bid to slow the spread of the coronavirus, but has fallen short of a full lockdown. Outside gyms and skate parks will be closed from today. Boot camps will also be reduced to 2 people. Prime Minister Scott Morrison says people need to stay at home as much as possible.
Don't gather together in groups. That's the simple way of putting it. Just don't do it. It's not helpful. It actually creates the risk. And when you're going out for shopping, you should be going for just stuff you need and do it and get home. It's not a time for browsing. It's not a time for catching up with friends on how it's all going. No, you can't do that anymore.
That's Australian Prime Minister Scott Morrison. South Korea says it will quarantine all new arrivals from overseas for 14 days. South Korea managed to flatten the curve of new infections without tough restrictions on movement and without a large-scale lockdown. Instead, it used an effective tracing and testing regime, which has allowed the most vulnerable patients to get the care they need quickly. But it is concerned about a resurgence of cases coming in from overseas, so has set up walk-through testing stations at airports. The BBC Laura Bicker reports from Incheon Airport, west of Seoul.
Over the last few days, around half of all South Korea's new coronavirus cases have come from overseas, many of them from Europe, and that is one of the reasons why everyone's being tested. To wait for your results, you're taken on a bus to a residential centre. You'll get your results in about 12 hours. Now, these testing centres are outside, but others within the country, you get these kind of plastic phone booth type testing centres where you can walk in and be tested in a matter of minutes. Before you arrive here, you go through a series of checks, a temperature check. Then you have to fill in all your contact details. They will verify that.
That's the BBC's Laura Bicker. India's Prime Minister has asked his country's forgiveness after imposing a sweeping lockdown that he said had hurt millions of poor people. Criticism has mounted over the lack of planning ahead of the shutdown, which was introduced with less than 4 hours' notice. Many of India's 1.3 billion citizens have been left jobless and hungry. Tens of thousands of migrant labourers have been forced to walk hundreds of kilometres to their native villages. In his weekly radio address, Narendra Modi apologised for the impact of the strict stay-at-home measures, but he says there was no other way to stop the rapid spread of the virus. Now, to reach the age of 100 is quite an achievement. 112 is even more astonishing. Two people in Britain have reached that impressive milestone. Bob Wayton from Hampshire and Joan Hockard from Dorset were born on the same day in 1908. Here's the BBC's Duncan Kennedy with their story.
They are Britain's oldest man and woman, Bob Wayton and Joan Hockard. Incredibly, both 112 years old today.
You'll have to live without me.
Bob from Hampshire is now also the world's oldest living man. Born on the 29th of March 1908, he's seen everything but never coronavirus, which means only his family and carers can get close for his birthday.
Corona, virus around, who knows what's going to happen. Certainly there will be no parties, there'll be no special visitors. I don't know.
Joan did have a little party. She's also in quarantine with her young partner Ken, who's a mere 92. But it wasn't always like that. Joan's early life was in London and Africa. Speaking last year at her home in Poole, she looked back on her school days.
I was very naughty.
Very naughty.
What we did was two of us went down to the town,
Yes.
to the shops, and with our green uniform, they recognised us.
Although Joan and Bob live in neighbouring counties, they've never met. But they do share one enduring philosophy that's so relevant for today. Even in adversity, they say, family and friends are at the heart of everything.
Duncan Kennedy with that report, and a happy birthday to both of them. And that's World Watch for today. Back to you, Marnie.
Ngā mihi Annabelle, and that's Midday Report, Te Pūrongo o Te Pūtūtanga for today, Monday, March the 30th. Stay with RNZ National. We'll bring you the latest COVID-19 briefing live shortly after 1 o'clock. And at 5 o'clock, Checkpoint will bring you a roundup and analysis of the day's news here on 101 FM. We'll be back tomorrow with interviews and the latest news from Aotearoa and the world. But for now, from the Midday team, kia haumaru te noho, stay well and at home. Hei a popo, kia tau, te mauri. And we're coming up to the news at 1 now with Kynwyn Curtis. RNZ News at 1, good afternoon. Ko Kynwyn Curtis tēnei. We'll be crossing to Parliament shortly for an update on the COVID-19 situation. In the meantime, here are the top stories. An infectious disease expert says the spread of COVID-19 will likely continue for 1 to 2 years around the globe, so visitors to New Zealand will need to be restricted for some time. Michael Baker, an epidemiologist at Otago University, says New Zealand has a chance of eliminating the transmission of the virus. But he says how quickly the virus is stopped in other countries will affect when the country can reopen its borders. Dr. Baker says the only thing that could change that is if a vaccine is produced or good antiviral drugs. A tourism body says the industry is counting on domestic tourism to keep money flowing to small businesses. Tourism industry Aotearoa says with the borders closed, the sector is missing out on $1.5 billion a month. It says the industry is expecting a limited ski season for locals, some domestic travel in the spring and then a slow return to international travel next summer. The number of people arriving in New Zealand has fallen to below 1,000 a day, crossing now.
Well, kia ora koutou katoa. Welcome to today's media briefing. I'm Dr. Ashley Bloomfield and I've got Commissioner Mike Bush here with me today. So today there are 76 new confirmed cases of COVID-19 in New Zealand. One of our formerly probable cases has now been confirmed as having COVID-19 and is therefore one of those new 76 confirmed cases. There have been no other probable cases reported today. And so you will see that the number of probable cases has actually dropped by 1 to 37. There have been no additional COVID-19 deaths. And 63 people have recovered from COVID-19. So, in summary, the combined total of confirmed and probable cases in New Zealand today is 589, 75 more than yesterday. Today, we have 12 people in hospital with COVID-19 infection, and it is good news that 3 of these people are expected to be discharged soon. There are people currently in Gisborne Hospital, Waikato Hospital, Whangarei Hospital, Dunedin Hospital, Auckland Hospital, Nelson Hospital, Waido Hospital in Blenheim, Taranaki Base Hospital. Each of those hospitals has 1 person, and Wellington Hospital, which has 4. 2 of the current inpatients are in intensive care, and for privacy reasons, we won't be providing other details on these patients. Our laboratories around the country continue to process and report test results quickly, and over the last 7 days, the average daily test number is 1,728. And just a reminder, anyone who has been tested is expected to be in strict self-isolation until they have that test result back. We are still seeing a strong link to overseas travel, as well as links to confirmed cases. And I just have some information that I've just received. On the 455 cases where we have sufficient information presently, 57% of those have a direct link to overseas travel. 26% are close contacts of existing cases. 15% have both overseas travel and or close contacts. And just 2% are currently community transmission. That's around 10 cases that we know are definitely community transmission. I'd like to shift to talk a little bit about flu vaccination. Flu vaccination is going to be a very important part of our overall approach to COVID-19 because if we vaccinate people, then we can reduce pressure on our hospital system, particularly through winter. It's very important that the people who are eligible for free flu vaccination are prioritised for vaccination. So that is people over 65, people with pre-existing medical conditions, pregnant women and children with a history of a respiratory illness, as well as our frontline health and other frontline workers. For people who are not in those groups, who might usually get a flu vaccination each year, please wait. We are prioritising our resources to vaccinate those high priority groups. We want to keep our frontline workers well so that they can support our COVID-19 response. We want our people who are most likely to get complications from influenza if they get it, and therefore end up in hospital, to be vaccinated first. We will not be, or you should not be seeking a vaccination or expect to be called for a vaccination if you're not in one of those groups until at least mid-April. This is an important part of our overall response. There is plenty of vaccine. We have 400,000 more vaccines this year than we had last year. That's a 30% increase, and already 800,000 have been distributed. There are stories of some practices who have run short, and so we are working right across the country to redistribute the existing vaccine that is already in the system so that all practices who need it are able to vaccinate those high priority groups. And a final word on our surveillance for COVID-19. There is an existing online, in fact, it's an email that you get each week called Flu Tracker. It asks about whether you've had symptoms of a fever or cough in the last week. We have now extended the questions on that Flu Tracker to include whether or not you've had a swab or a test for COVID-19. And I would encourage everybody to help contribute to our tracking of COVID-19 by registering online on the Flu Tracker survey. The website will be in our media release, but just quickly, www.info.flutracking.net. This is a practical way that we can all contribute to the monitoring of influenza-like symptoms and specifically to COVID-19 across New Zealand. Mike, I'll hand over to you.
Kia ora Ash, kia ora koutou, whānau. Three things I'd like to cover off today. The first one is in relation, a general briefing on compliance. Secondly is the impact on policing nationally. And third thing is to talk about how we're going with the returning New Zealanders. First off, in terms of how New Zealanders are complying with us, the vast majority of Kiwis, of people inside New Zealand, are complying brilliantly. And I want to acknowledge and thank them for doing that. They know that to stay home saves lives. At the same time, those people who are complying are very passionate to ensure that others comply. To that end, as you know, we stood up a online facility 10.5 at police.govt.nz at 1 o'clock yesterday. Since that was stood up, we've had 4,200 reports of people believing others weren't complying. Again, it shows how determined Kiwis are to ensure that everyone complies with us. We crashed that system, we've put it back up again, it's working. But again, I just want to say that everyone needs to comply in this realm. We have, for example, tourists who think it's okay to drive around the country in their camper vans. It's not okay. Stay absolutely put. Stay in place. We have, over the last few days, had cause to arrest 3 people for persistent breaches. Now, 2 of those people were taken into police custody, but later released without charge. 1 person remains in police custody, mainly because they had other outstanding matters in front of them. But again, we will be out there ensuring people do comply, because we can't say it enough, stay home saves lives. I also want to talk about how things are impacting on policing in general. A few days ago we talked about the anticipated rise in family violence, family harm offences. Initially we did see a small rise, but it's pleasing to see that in the last few days that's been reversed, and we've had a very slight reduction in family violence, family harm reports. I think that goes to the fact that people really do want to respect each other inside the home and know how challenging this will be for everyone. But of course we've got to stay the course on that. We've seen a massive decline in public place violence, as you would expect. we've seen a significant decline in the number of people being arrested and placed into police custody generally, all positive things which enable us to redeploy into those other priority areas, which include ensuring that people comply with the COVID-19 restrictions. I can report that we have 2 of our own staff that have tested positive for COVID-19. They are at home, taking every precaution, obviously. They're not hospitalised, and we're putting every piece of support we can around them. I'd also like to report, Ashley, you'll be interested in this. You may know that last week we graduated the Ashley Bloomfield Recruit Wing, 59 staff. Today, all 59 of them have deployed and are out there on the streets of New Zealand doing everything they can to keep New Zealand safe. Well done on that, Ash. Finally, I'd like to talk about the number of returning New Zealanders. Since over the last 3 days, we've had 4,547 Kiwis return. As you know, we have a process in place, an end-to-end process to assess them and then ensure that they are compliant. 94 of those people were symptomatic and are in quarantine. 1,200 of those persons did not have a satisfactory self-isolation plan, so they are in managed self-isolation. About 3,200 did have a plan and they are self-isolating, but are, we are sure, complying with that, although we will ensure that we have a process to visit those people or to ensure that they are complying with those restrictions. So that's all I have to update at the moment, other than to say and acknowledge those essential workers that they're out there keeping the country going, keeping the country safe. They're doing a wonderful job and they should be acknowledged for that. Kia ora.
Can you give us some more details about the 3 people that were arrested? What were they doing? Were they just out and about when they shouldn't have been?
Yeah, they were out and about. They'd come to our notice before. As per our 4-step plan, they'd been previously warned about their behaviour. They decided that they wouldn't oblige, so we obliged for them. They were 2 of them were taken into custody. They stayed there for a short time, and then they were released without prosecution.
What about those 2 police who have tested positive? How many of the police force are now in self-isolation because of those 2 cases?
They're quite different cases. The first case, I have some detail around, that was contacted via a police role. So there were a number of people that they have been in contact with, so we're doing contact tracing and self-isolation in terms of that. I can't give you too much detail in terms of the second case, other than to say that we have several hundred police officers across the country self-isolating as a precaution and in response to that and other things.
The fact that they contracted COVID-19, does that suggest that police don't have adequate PPE gear when they're dealing with the public?
This was quite earlier on, but we are building our stocks of PPE. We're taking a normal risk-based approach to that, but at the same time it's important that we get sufficient PPE to them, and that's been a work in progress over the last week.
And even though you say most people are complying, just looking around areas like Oriental Parade yesterday, there were hundreds if not thousands of people still out there, probably all within the rules, just exercising and doing what they're allowed in their local area. But is there a more firm instruction you can give people around congregating? So if you see someone down there, should you actually just go home if there are too many people in the space?
Yeah, no, it's a very good point. I too drove past Oriental Parade last night, and it did surprise me how many people were out and about. Yes, it's within the rules, but I observed a number of people that weren't keeping their social distance. Obviously, some were still in their bubble, but it was obvious to me that some weren't, and the social distancing was not being adhered to. I think that's something we really need to consider, and I'll take this opportunity to appeal to people. Again, you must stay local. That doesn't mean wandering off 5 or 6 miles. It's stay in your neighbourhood, stay close to home, and really keep that social distancing. I think if people aren't complying, we're going to have to revisit this.
So shouldn't your force actually be doing more to disperse those groups of people if they congregate like that?
Yes, absolutely. So that's what we're considering. As you know, the sun came out in Wellington at about 4 p.m. and everyone took advantage of that. I really counsel against that. And again, if you're out there and you're seeing a lot of other people out there, you must keep your distance, but stay local, stay close to home. Thank you for raising that.
What action have police taken as a direct result of those 4,200 or so reports to the 10.5 website?
Yeah, so a lot of them are general. What I can tell you is about 1,000 of them relate to business and the rest relate to people. So for example, some of those reports are quite general. There are people congregating at Mairangi Beach that shouldn't be. So we'll deploy into that as a tasking. Some of them aren't specific enough. So some of the reports are so-and-so's at the beach, or there are people at the beach, we don't know which beach. But we'll prioritise those and we will task our staff accordingly.
We've seen, you mentioned yourself that there were tourists driving around in camper vans, and we've seen a party of backpackers down in Queenstown. Are there any sort of specific punishments or anything that you could do for people on tourist visas who may not be adhering to the rules?
Yeah, that is a matter we could look at with immigration as to whether or not, but I think that's, I think we're better to give advice and actually get out there and intervene and educate those people in the first instance. But people who are tourists must know that they cannot drive around the country from destination to destination. I had it recounted to me a few days ago, someone travelling from Tauranga for work purposes. They couldn't move on the desert road for camper vans. That's got to stop. We will be out there, we will be educating in the first instance, but I appeal to those tourists, stay where you are. That's the rules.
And what would happen to them? Are we looking at a fine? Are they being forced into quarantine?
Well, if they're persistent, repeated breaches, yeah, we'll take action against them, absolutely, as we did with the 3 people I talked about.
Can you give us some detail on these checkpoints that are being set up? How many are there? What are you sort of looking for?
Yeah, look, checkpoints at this point aren't part of our deployment model. We see them occurring and we will give consideration to whether or not they're necessary, but at the moment we're more mobile in terms of our interventions.
What would you need to see before you start setting them up?
I think there's, so we're working with a lot of local communities, as you would have seen through your media. A lot of people want to set up checkpoints and keep people out of their places, out of their areas, out of their towns. We want to work with them to make sure that's absolutely lawful.
Dr. Field, can I just ask, is there community transmission in Matamata?
We know there's a cluster in Matamata, and we know that there was an index case that was associated with overseas travel. What's not clear is the extent to which there might be community transmission. So we're doing a full investigation of that cluster at the moment.
So how many people have tested positive within that cluster?
As of yesterday, there were 9, and they were expecting another few, so somewhere between 11 and 13, but we'll have the updated numbers on our website for that cluster after this briefing.
Can you give us any more details about that? Was it linked to a specific business, or how did that work?
Well, I think there's been social media postings linking it to a specific establishment and associated with a St Patrick's Day celebration.
The Southern DHB last week said it was still seeking 257 contacts from the World Hereford Conference. How many contacts are yet to be traced from confirmed cases, and what does that mean in terms of a potential backlog? We're going back weeks now in terms of trying to track down all those potential contacts.
So what I can say is that there's much greater capacity now to do that contact tracing, and it's always work in progress. For example, sometimes it takes 6 or 7 phone calls to see if somebody can be contacted. If they can't be, then we work with other organisations, including the police, potentially to go and visit that address. So it depends on the number of contacts associated with each case. Right now we've got around 100 people now working in our National Contact Centre, and that number is increasing daily. But so far we have every contact that we have been notified, at least up until the last 2 days, has been followed up at least with 1 phone call.
Dr. Bloomfield, following the first death on the West Coast yesterday, are hospitals changing the way that they treat anyone with flu-like symptoms?
Yes, so the case on the West Coast was someone who presented with where COVID-19 wasn't part of what we'd call the differential diagnosis when they came in. So there were good precautions taken for if that person had had influenza. Now we have suggested to district health boards, and in fact there is a common approach to this, is anyone coming into ED who has what we would call a lower respiratory tract infection, so cough, fever, whether that's pneumonia or bronchitis, is being treated as if they are COVID-19 until proven otherwise, and therefore the appropriate measures taken in terms of personal protection.
How many cases fall into that?
There was an update to the website yesterday on who's eligible, but there are still people like pharmacists and carers who have come to us saying they don't feel safe and they feel like they might pass it on. What's your advice to those people?
Well, PPE is one part of keeping safe in terms of keeping yourself safe from infection and, of course, preventing passing on an infection. In the latter case, anyone who has symptoms shouldn't be at work or out of the house. If they're, they shouldn't be going out to the shop or doing anything. In the former instance, you can see in supermarkets and a whole range of places that they have put in distancing measures to make sure that social distancing is maintained. Masks can have a role, and one thing we are doing is making sure that all our frontline workforces, who we wouldn't usually be providing masks to, do have some masks, and that will include pharmacies, midwives and others, so we're making a particular effort to ensure they have masks should they need to wear them. And hand washing, of course, is still a major part of keeping oneself safe.
What about home support workers? Will you provide them masks? Because they're really worried that they're heading into a lot of elderly people's homes and the risk of transmissions if they were to come into contact with it.
Yes, I think that's a really vulnerable group, the people who they're looking after. So the advice does cover, that is on our website, covers home and community support workers and the sorts of situations where they do or don't need to use protective equipment. I'm also aware that, as you've said, some people feel that wearing a mask is going to help protect them and will also protect the people they're looking after. So we're going to make a particular effort to ensure that our home and community support care workers have got, through their organisations, access to masks. If they need to use them, then they've got them.
Yeah, and what about, we've been contacted by people that have donated blood, and they're concerned that the people that are taking the blood aren't wearing enough protective equipment. What would be your advice to the blood service?
Well, those are health workers and they'll be guided by the advice that's there. Not everyone in contact with someone in a healthcare setting needs to wear personal protective equipment. The majority of care will be in situations where people haven't got a respiratory illness or any symptoms and don't have any risk of having it. And so they would just take the normal precautions they would when they were taking blood or in any other setting where it was required.
The PPE guidelines for home care workers that were put online last week, they're no longer accessible. They've been taken down off the Ministry of Health website. Do you know why that is? Was there an issue with what was in there, or?
Not that I'm aware of. I didn't know they'd been taken down. I've got a hard copy. I think they're very good, so I'll check that when I get back just to make sure they are available.
Commissioner, what planning are you putting in place for widespread coronavirus in the police force? Do these 2 positive tests make you feel nervous?
Yeah, we're always very concerned about our staff. Ever since we kicked this off, we've been working, like every other government agency and essential workforce is, around building a contingency. So we have a contingency plan in place. We're even looking as far and wide as what's happening inside the NYPD and taking learnings from other organisations. But I can assure you that Deputy Chief Executive of People is leading our contingency planning around our own workforce.
Speaking of New York,
can I go over here? Because we haven't been over there.
There's been concern about Gloriavale residents not adhering to the restrictions. What are the police doing to ensure that Gloriavale residents are complying with those self-isolations?
Yeah, I can't give you the absolute detail. I'm aware that it's been in the media today and our local police are examining how they approach that. Can I get back to you on that for further detail? Sure.
Commissioner. New York. So are either of those 2 cases that you've identified within the police force, were either of them linked to a trip to New York, and are there any other police officers who are being tested as a result?
No, the first one, the one I have more detail on, was local in terms of what that officer was doing as part of her role.
And the other case?
I can't give you the detail, but I do not believe so. But allow me to confirm.
Are you testing to ensure there's not a cluster there, or are you testing?
You know, they're quite separate. Yeah, very separate.
Just on the several hundred police officers who are self-isolating, how many of them have been tested?
I can't give you that information. It's more precautionary, and I don't believe any of them are symptomatic.
Can you be more specific about separate than several hundred? Can you give us any numbers or?
Yes, I think I can. Look, please don't quote me. I think it's 380, but the reason I'm not being specific is because I don't have that right in front of me.
Commissioner, do you believe that supermarkets are breaking the law at the moment with regard to price gouging?
I think you'd need to be more specific, and I do know that others will talk to that point today.
Commissioner, have you seen the reports of a kayaker having been rescued off the Coromandel, and what's the advice for anyone who wants to?
Yes, I have seen that report, and again, it's not in line with the advice or the compliance advice that we've given. So it's a really good example of the fact that if you're going to do this, you're putting others in jeopardy and causing others to come to your rescue. So we more than strongly advise against that kind of behaviour.
Does that apply to paddleboarders as well?
Yes.
And the backpacker party in Queenstown, what details can you give us about that and how you dealt with it?
Yes, our staff responded to that. Because it's in the reporting, that they decided that was their own self-isolation bubble. That's very poor advice. They've been strongly advised to break into much smaller groups, and under my definition, that's a mass gathering, and they should cease.
Does the business that sort of facilitates the opportunities for people to breach these self-isolation, could they face punishment as well?
I believe so, absolutely. Yeah, yes. Short answer is yes.
There are reports that the woman on the west coast was not given a ventilator, a respirator, a ventilator, and that she had no connection to international travel or anything else. What information do you have about those two details?
So I'm just going to make a general comment about the use of ventilators. The West Coast Hospital, or Grey Base Hospital, can ventilate people if needs be. But as with generally in any illness, the decision on whether to ventilate someone or not is a clinical and family decision. And that will be the case as we go through this COVID-19 experience. There's nothing unusual about that. So not every person who gets COVID-19, who may then be on a palliative pathway, will be ventilated. All our hospitals have the capacity to ventilate people if they need to be ventilated.
And the fact that there is no sort of obvious connection to international travel or anything there, is this another community outbreak cluster, or?
When I last saw and sought information, there were a couple of leads being followed up around a link to international travel still.
Is there any staff that are in isolation, are they all still symptom-free?
That's my understanding, but if I find out anything different, I'll let you know.
Commissioner, is there any advice being developed for the likes of home care workers to develop work bubbles so many people aren't going into so many homes, or special rostering?
Yes, actually I know that home and community support providers are looking at this so that they have a small number of caregivers looking after the same people. Of course, you can imagine if people require 7-day-a-week care, then they need to rotate and have rosters. That is for the staff, but that is absolutely an approach that I know is being used, and I think it's a very good approach.
And what about hospitals? What are they doing beyond cancelling elective surgeries, restricting visitors? What measures are they taking, or could they take, to stop any undetected spread?
Well, I know that they've got measures at the front door to make sure that anyone coming in through the ED is being screened first of all to see if they're symptomatic, and if they're coming in for a respiratory type illness, they go down a different pathway. Of course, a key part of this is to make sure that anyone coming into the hospital, whether they're staff or visitors or couriers, so on, are not symptomatic, and that we need to really keep our healthcare facilities COVID-19 free if we're going to protect them to be able to do the work they need to do.
Should we take the last question down here, Ash?
Sounds good.
Commissioner, is it fair to say that tourists are responsible for the majority of lockdown breaches?
No, but again, I strongly advise tourists that they're not to move around the country, they're to stay in one location.
Is there one particular group in society that's sort of been the least compliant?
We haven't done the analytics on that yet, maybe, but
coming?
no, we don't have the answer to that. Good.
Thank you very much.
Thank you.